Today we are looking at chronic kidney disease. In mammals, the kidney functions as a major excretory organ for elimination of metabolic waste from the body. In most species, death occurs within a week after total cessation of renal functions. Azotemia refers to accumulation of nitrogenous waste in the blood. Blood concentration of creatinine and urea are measured at indices of azotemia. The role of kidney in maintaining a life is a composite of several functions. Water and many electrolytes are conserved by the kidney in times of negative body balance and are excreted in times of positive balance. Chronic kidney disease, CKD, is a worldwide public health problem with adverse outcomes of kidney failure, cardiovascular disease, and premature death. Accurate estimation of kidney function is central to the detection, evaluation, and treatment of chronic kidney disease. Glomerular filtration, GFR, is widely accepted as the best overall measure of the kidney function. Chronic kidney disease, as the name stands, is chronic. It can last for years or it can be lifelong. So it is a long-standing disease of the kidney leading to renal failure. The kidney filter waste of and excess fluid from the blood, and as kidney fails, waste build up. In Nigeria alone, there are more than 100,000 cases per year. Chronic kidney disease is a condition where the kidney gradually loses function over time, causing excess fluid and waste to build up in the body. There are 5 stages of chronic kidney disease. We have the stage 1, which is where the kidney damage with normal or high GFR. We have the stage 2, kidney damage with mild and low GFR. Stage 3, moderate low GFR. Stage 4, the severe low GFR. And stage 5, which is up to the stage of kidney failure. As the disease progresses, symptoms may include swelling of the feet, ankle and hands, shortness of breath, feeling sick, blood in the urine, fatigue, loss of appetite, sleep problems, urinating more or less, decreased mental sharpness, muscle cramps, and dry, itchy skin. Other health consequences of chronic kidney disease include anemia or low number of red blood cells, increased occurrence of infection, low calcium levels, high potassium levels, and high phosphorus levels in the blood, depression or lower quality of life. Chronic kidney disease can be caused by high blood pressure, diabetes, high cholesterol, and kidney infection. It is a common condition that can affect anyone, but is more common in people who are blacks or of South Asian origin. There is no cure for chronic kidney disease, but treatment can help relieve the symptom and stop it from getting worse. And your treatment will depend on the stage of the chronic kidney disease. Most importantly, lifestyle changes are required to help you live longer. It might involve a special diet, incorporating physical activities in your routine, sleeping well, visiting your health practitioner more often, and taking your medications. But most importantly, it's good to take care of yourself. It is good to check your blood pressure. And when it's high, if you're on blood pressure medication, you take it. It is good to check your blood sugar. And if your blood sugar is high, you make sure you take your medications. It is also good to check your cholesterol and to check if there are infections in the kidney, so that the kidney can keep doing its work of filtration, taking away waste and returning the one that the body needs to be able to live and thrive. I would like to hear your comments about this, questions, and I'll drop under the video and I'll come back to answer you. please subscribe, turn on the notification bells so that you get the videos as they drop.